The federal government has made some major changes to the Affordable Care Act for 2026. So what are those changes and what do they mean for you? Coming up, we'll speak with a panel of experts who will offer real answers to your questions. It's all ahead next.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome to Your Health, Your Coverage, Your Guide Town Hall. Thank you for joining us. I'm Carla Hill. The Centers for Medicare and Medicaid Services report that nearly 30 million Americans are enrolled in an Affordable Care Act plan through the health care marketplace in 2025, and that includes nearly 5 million Floridians. And that's why it's so important to know about all of the changes in coverage for 2026. Let's take a quick look at some of the changes coming soon.
Living Minute, a look at the latest medical innovations changing our lives.
If you get your health insurance through the Affordable Care Act marketplace, there are some changes you need to know about.
This year, there's been a pretty significant shift toward patient and consumer responsibility. And so what people can expect to see this year is a change to some of the eligibility requirements and enrollment period.
And there are changes to who qualifies for special enrollment. Plus, plans will no longer be automatically renewed, and enrollees need to update their income every year.
It's imperative that consumers take an opportunity to update any information concerning their income, to make sure that they've reconciled their taxes, to make sure that they've communicated that they received advanced premium tax credits in the past.
And new enrollees, including those who enroll outside open enrollment due to a life event such as a birth, marriage, or loss of income, will need to prove eligibility before they receive subsidies.
Excellent. And once again, we have a great panel with us, and they will be sharing some vital information and answering the questions so many of us have. Please welcome Dr. Jean-Janice Jacobs, the director of the University of South Florida Covering Kids and Families Organization and director of the Covering Florida Navigator program. We're also joined by Dr. Wendy De La Rua, an assistant professor of clinical pediatrics at the University of Miami Miller School of Medicine Pediatric Mobile Clinic, and Gail Daly, the senior vice president for Plan Product for Sunshine Health. Welcome to all of you, and thank you for being here to share your valuable insight. So first up, let's look at the enrollment dates. Enrollment opens on November 1st and closes on December 15th for a January 1st start date, and on January 15th for February 1st start date for those who enroll and pay their first premiums. Now, as for specific changes, here are some of the important things to know for 2026. There will be no more special enrollment periods. That's very important. All of your documents will be due before any coverage begins. Proof of income will be due in 90 days with no exceptions, and you will not be allowed coverage if you have not filed taxes in previous years. And here's another big one. DACA recipients, also known as Dreamers or those under deferred action for childhood arrivals, will no longer be covered. Dr. Jacobs, these changes are going to have a significant impact on many of our viewers. Talk a little more about what people can expect.
Absolutely. So I want to clarify just a little something about the special enrollment period. This is actually specific to those individuals who are at 150% or below the poverty level. Once upon a time, up until actually August 26, those individuals had a rolling open enrollment period that allowed them to gain access to the health insurance marketplace throughout the year. Going into this year, that's not an option. Going forward, there's also some additional pieces concerning making sure that there's that consumer responsibility. One of the really big things is not making open enrollment one of those passive processes. So really wanting to make sure that people are updating information, wanting to make sure that any kind of taxes or advanced premium tax credits that might have been had in the past have been reconciled. Also making sure that if you owe any premium payments for previously enrolled plans, that individuals are making sure that they're shoring that up before getting enrolled into coverage as well, because that will actually impact their ability to be able to be enrolled. So lots of changes, but one of the big things that is that, with our Navigator program, we try to make sure that we walk people through that process and provide them with the necessary supports from an education component, but just also as a support.
Really great to know that the support is there. Thank you so much, Dr. Jacobs. Gail, we mentioned that you are with Sunshine Health, an insurance company. How is the Affordable Care Act going to be different for your company from an insurer's perspective?
Well, thank you, Carla. So from an insurer's perspective, the Affordable Care Act, especially the enhanced advanced premium tax credits, which we call EAPTC, that's a mouthful, has been a game changer. These credits have helped millions of working Americans afford coverage, and companies like us and Better Health, that means that we've been able to provide broader services to a bigger population. With congressional action, these credits will expire at the end of the year, at the end of 2025. So this will lead to major shifts in open enrollment, which starts November 1st. If the EAPTCs end, individuals may drop coverage due to higher premiums, increasing costs to those who remain. We continue to urge Congress to preserve the EAPTCs that have made it possible for 24 million working Americans to afford coverage. That's actually a doubling since 2021.
And Dr. De La Rua, bottom line is everyone needs health care. If you can, talk a little about how you're able to assist patients from your mobile clinic and how these changes in eligibility may impact your ability to help people in the community.
Sure, Carla. So the Pediatric Mobile Clinic has been serving as a medical home for uninsured children in Miami-Dade since 1992. We provide comprehensive care from well visits and immunization to sick visits, medication management, as well as mental health care. With the new changes in marketplace eligibility, we anticipate an even greater demand for our services. And we are a nonprofit program, so our capacity is limited, but we are mostly concerned about children with chronic and complex conditions who need access to specialists, therapies, medications, things that sometimes go beyond what we can offer in the unit. So for these patients, insurance coverage is not just helpful, it is essential. Some of the things that we do to bridge that gap is that we work closely with certified navigators who can guide families step by step through the application process, whether that means Florida Kid Care, Medicaid, or the marketplace plans.
And Dr. De La Rua, one more thing, we really appreciate your insight. And everyone watching, remember, we are here to answer your questions. So please send them in by email to allhealthtv.com or via our AllHealthGo Facebook or YouTube channels, and we will try to get them answered during the show. Dr. Jacobs, a question that I'm sure is on everyone's mind. Talk a little about eligibility and federal poverty line. What exactly is that?
Absolutely. So essentially anyone can access the health insurance marketplace, but affordability really comes around those advanced premium tax credits, which goes along the lines of the federal poverty level. So the federal poverty level is the point to where they've discerned that individuals can access advanced premium tax credits. And so at 100%, being around 15,000, almost 100, so 15,060 actually, as you all see on the screen from the previous year, but actually closer to 16,000 rather mark for 2025 coming forward. That is where individuals who are just, single family households actually do qualify for advanced premium tax credits. However, if you're making under that $15,600 150, based upon eligibility requirements, you may find yourself either qualifying for Medicaid or otherwise falling into what's called the Medicaid gap, which is basically those individuals who don't get those advanced premium tax credits in the marketplace, and those individuals who don't quite qualify for Medicaid as well. And in those instances, obviously, we're providing support and services to link them to services like free and charitable health care services, as well as federally qualified health centers throughout the state of Florida.
Thank you. And Gail, there are some other factors that come into play for determining eligibility.
Sure. So eligibility coverage isn't only about income. There are other influences like employment status, your geographic location. But there are three things that we see coming down the pipeline that may be tightening the eligibility. The first one is the removal of the automatic re-enrollment. People will need to re-verify their eligibility each and every year. The second is the removal of provisional eligibility. So applicants must pay full premium until their verification is complete. Super important. And third is stricter repayment rules. If your income changes, you may have to repay the full amount of excess tax credits. Small businesses and self-employed workers may have a large portion of the marketplace enrollees. In fact, 2.7 million of Americans claimed premium tax credit in the year of 2022. So if these credits expire, many of these individuals would lose their affordable health insurance coverage.
And Dr. De La Rua, one of the most important groups of people needing coverage are kids. Parents don't want to get caught up in the red tape when their kids are sick or they need that medical attention. What can parents do? How can they still get help?
So thankfully, many children will remain protected under these changes. Most of the new eligibility rules will impact adults. But what's most important, Carla, is that families don't try to navigate this alone. I strongly encourage parents to sit down with a certified navigator who can carefully review each family's circumstances and guide them to the program that best fits their needs. So that way, when the child gets sick or they need preventive care, parents have peace of mind knowing that their child is going to be covered and that they can get the help that they need without delay.
Thank you so much, Dr. De La Rua. That is very important information. You know, navigating your way through all of the twists and turns found in the 2026 health marketplace can be tricky. And that's where navigators come in, like Dr. Jacobs. And here's more on that.
Living Minute, a look at the latest medical innovations changing our lives.
This year's changes to the healthcare insurance marketplace plans can make picking the right one for you and your family confusing. But that's where an Affordable Health Care Act navigator can help.
Navigators provide an invaluable service. We provide free, unbiased support and care with navigating the healthcare system through the health insurance marketplace and through eligible plans.
Navigators can't recommend specific plans, but they can help families decide which one is best for them by going over the family's needs and other considerations.
We help to have families understand what their costs are, really what their options are, what advanced premium tax credits are, and really make consideration around what's going to be best for folks' families.
To do that, navigators ask you to think about what exactly your healthcare needs are.
You know, do you have special healthcare needs? Do you have specific doctors that you seek? Do you have certain hospitals that you need to go into? And you want to be able to best plan. That's what navigators do. We help people navigate systems. We help them access affordable care. And we help them to make determinations that's going to improve the quality of their life.
So, Dr. Jacobs, I'm personally so glad that you are one of the people that really our audience can count on. Tell us more about navigating what's coming up in 2026.
Absolutely. So there's been some significant reductions to federal dollars to provide this service. However, the Covering Florida Navigator program remains committed to ensuring that people have access to navigator services across the state of Florida. So one of the things to know is that there's going to be a lot more virtual appointments that are going to be made available through platforms platforms such as Teams, Microsoft Teams, Zoom, as well. We do have quite a few that are still in person throughout the state of Florida. We were able to continue to partner with the federally qualified health centers to provide services at their locations, as well as quite a few nonprofit organizations across the state, including a couple of area health education centers, health planning councils, and nonprofit organizations such as the Family Healthcare Foundation in Tampa Bay. So we will still continue to be available. We actually have an 877 toll-free line that I know is going to come up at some point today, but navigators are available to speak with you throughout that open enrollment period, 7 days a week, and a couple of extended hours throughout the week. So we want to make sure that we're readily available to consumers, especially around those critical dates, like the December 15th date to get that January 1st coverage, and also to ensure that folks get into that final date of January 15th. So we have certified navigators that are on board and prepared to take your phone calls, to field your contact forms, all of that.
And I believe our audience can see on the screen right now all of the things that you just mentioned, the 877 number and another number and website for the healthcare marketplace. Yes. Again, great to know that there is support for the citizens of Florida to make sure that they're able to get this coverage. You know, we have learned that Affordable Care Act marketplace plans have shown a spike in premiums, which are said to be the largest increase since 2018. Gail, I want to follow up with you, and how can insurance companies offer low cost and no cost insurance and still be able to operate?
Well, that's a great question. Insurance companies like ours are able to offer low cost and even no cost plans by designing coverage that balances both affordability with essential benefits. We do this through a few key strategies, 3 of them actually. One is, ensuring that our members are getting the preventive care that they need to stay healthy and to keep costs down. The second is creating valuable and effective provider networks, very important. And the third is designing plans that allow for flexibility with our members. So Ambetter Health really encourages potential members to think about their health care needs, to think about the budget, and also to think about how the plan can support their overall care when choosing.
And Dr. De La Rua, speaking of low cost and no cost insurance, can you talk about the preventative services that are offered through the ACA? And do you have to be on a certain plan, or are these services available to everyone?
So this is a great question, because obviously we all want to know what is going to be covered under these plans. And preventive services recommended by the United States Preventive Service Task Force, the Advanced Committee on Immunization Practices, and the Health Resources and Services Administration are covered in almost all non-grandfathered marketplace plans when they're in network. So some of the specific preventive services available to children would be well visits, immunizations, developmental screening, hearing and vision screening. So for the most part, families don't need a special plan, they just need to stay in network.
Thank you so much. And we have a really active audience. We have a question from Aaliyah, and she's writing on behalf of a neighbor. She writes, "My neighbor is dealing with a devastating cancer diagnosis, and she's saying she's looking for catastrophic coverage from the Obamacare plans. Can you tell me more about that kind of coverage? Who qualifies, and is it more expensive than a regular Obamacare plan?" Dr. Jacobs, are you able to address Aaliyah's concerns and her question?
Absolutely. And actually this past week, a pretty significant thing came out concerning catastrophic plans. So once upon a time, up until just August 25th or 27th, when we started this new funding cycle, catastrophic plans were relegated to individuals who were under the age of 30. However, what could potentially help or support Aaliyah's neighbor is the opportunity to apply for a hardship exemption, which will allow her to be able to get access to catastrophic plans even if she's over the age of 30. So that's a new provision that came out this past week. Catastrophic plans offer an opportunity for individuals to still get some services. It's usually about 3 visits that are before they start going into that deductible kind of component. And they usually are just kind of like a package deal just to make sure that people have that coverage in the case of an emergency. It's quite possible that the network by which the neighbor needs to navigate quite possibly could work for her needs and her healthcare needs. But what would really be helpful is for have her sit down with a navigator, see what her options are in terms of if she qualifies for advanced premium tax credits and if Catastrophic is going to be her better option.
Great to know. Thank you for that.
Absolutely.
We also have a question from Quinn. Quinn says, I'm a healthy 39-year-old guy, and I've never really had health insurance as an adult. If I get sick, I go to urgent care and go home. So he wants to know why he needs health coverage. How will it help him? Gail, would you please answer Quinn's question and let him get the information?
Yes, absolutely. Quinn, we hear you. You're not the only one thinking this way. But health coverage isn't just about emergencies. With insurance, you can access preventive care, such as regular checkups, screenings, and early interventions that can help to prevent serious illnesses that may come down the pipeline 5 years, 10 years from now. And if something unexpected does happen, like an accident or a major diagnosis, coverage ensures that you're not facing these costs alone. Plans offered on the health insurance marketplace, like Amateur Health, make it possible for people like you to have affordable coverage that fits your unique needs.
Thank you. I'm really excited about this engagement. We now have Daniela, and Daniela says, we don't have health coverage because we don't pay taxes. My husband and I get paid in cash. I'm a house cleaner and my husband is a handyman. But my daughter, who's 5 years old, is now dealing with some breathing issues. I'm concerned that it may be asthma, but I'm afraid to take her to a doctor because of the cost. Is there a place I can take her? Dr. De La Rua, can you please take this one?
Of course. So first of all, Daniela, don't wait. Asthma symptoms and respiratory symptoms in general should be evaluated right away. So you can take your daughter to a public hospital and she will be seen regardless of insurance. Holtz from hospital from Jackson Health System, they have excellent pediatricians that will happily examine her, but they also have social workers and navigators on site that can help you connect you to a program that fits for you. There is also the University of Miami Pediatric Mobile Unit where I work that we provide services to kids that are uninsured. In Broward, if you're from Broward, there are also mobile clinics associated with Joe DiMaio's Children's Hospital, and they would also be seeing or see patients without insurance. There is also the Community Health of South Florida and the Center for Haitian Studies in Little Haiti, and they all provide affordable care to uninsured families. So bottom line, your daughter can and should be seen now. And I want everyone out there to know that there are safe, trusted places in our community where children and adults can receive high quality care. So don't hesitate to take your kids to them or to go yourself to one of them and get evaluated.
We have another question. This one's from Joey. He says, I have a full-time job, but my company is a small business that doesn't offer health insurance. I don't make a lot of money, but I make too much to qualify for low-cost plans. I've gone without insurance, but I'm getting into my 40s, and I want to get tests like colonoscopies to prevent cancer. Is there a plan that makes sense for me? Gail, is there a plan for Joey?
Joey, thanks for sharing that, and there certainly is. You're exactly the kind of person that the marketplace was designed to help. Many small businesses and self-employed individuals fall into that middle income category, and the enhanced tax credits have made coverage more accessible for them. Even if you don't qualify for Medicaid or low-income, low-cost plans, the marketplace offers options that include things like preventive care. So I heard you mention colonoscopies. That is covered at no additional cost. We recommend entering your information. When you see the plan option benefits that are available for you, you can start entering November 1st. That's when open enrollment for Marketplace begins.
And now, before we go, I want to come back to you, Gail. We're going to get a bit of a roundtable from all of our guests of just summarizing the important things that you think our audience needs to know. Gail, do you mind going first?
Thanks, Carla. My message is simple. Health coverage matters. It's not just about treating illnesses, it's about preventing it, protecting your finances, and giving you peace of mind. The Affordable Care Act, especially with the enhanced tax credits, have helped millions of Americans access affordable and comprehensive care. We urge our viewers to stay informed as directions are rapidly changing and explore their options during the open enrollment period, which starts November 1. If you sign up by December 15th, your coverage will start on January 1st of the new year. So, very important to remember these upcoming deadlines.
And Dr. De La Rua, what is the message you want to give families concerned about what their coverage will be like and the importance of keeping our families healthy?
So, Carla, at the heart of every parent's worry is one simple hope, that their children will be cared for when they're sick and supported as they grow. So I want families to know that even with changes to coverage, most children in Florida remain protected. There are navigators and community clinics ready to guide you every step of the way, so you are not alone in this process. Your child's health comes first. Don't delay care out of fear or confusion. Reach out, ask questions, and let us help connect you to the options that are available out there. So get ready, apply right away when enrollment opens, and ask for help if you need it.
And finally, Dr. Jacobs, you've given us so much information already. What is your message for people watching today?
The Covering Florida Navigator program is here to provide support and assistance for individuals who are seeking to get access to the health insurance marketplace and who need to be pointed in the direction by which they need to access the health insurance that's best for them. We work with a group of individuals across the state, including federally qualified health centers and other nonprofit organizations, to help individuals find the care that's necessary for them. I highly recommend that you visit our website, www.coveringflorida.org, or contact our toll-free line, 877-813-9115, to get scheduled with an appointment with a navigator so that you can be ready for open enrollment starting November 1st.
Well, Dr. Jacobs, Dr. De La Rua, and Ms. Daly, we thank you all for your great insight. And to our viewers, we hope you got your questions answered and learned more about what to expect from the changes in the Affordable Care Act in 2026. Remember that enrollment begins November 1st and ends December 15th. Here's that list of resources again, and if needed, contact a navigator to help you figure out what is the next best step for you and your family. I'm Carla Hill, and I'll see you next time.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.